shorter form of dystrophin. Let's discuss two important parts of Elevidys and how they work. 1. The transgene, which provides the instructions to make a new form of dystrophin called Elevidys microdystrophin. While not exactly the same as dystrophin, Elevidys microdystrophin was designed to help protect muscles from damage. And 2. The Elevidys vector, which carries the transgene to muscle cells throughout the body. Once the vector has entered the muscles, it delivers the transgene, and its job is then done. It leaves the muscles and is gradually eliminated from the body. At this point, the body uses the new instructions from the transgene to make Elevidys microdystrophin. The transgene is designed to stay in the muscles and to continue providing the information needed to make Elevidys microdystrophin. Now, back to our model airplane example. Remember you were missing the instructions and didn't know how to put it all together? You need instructions for your model plane, just as the body needs instructions to make dystrophin. Imagine you search online to find instructions to build a plane. You find some to make a different model airplane, print them off, and you are able to create a different plane using many of the same parts. This is similar to what happens to the body of a person with Duchenne. Elevidys gene therapy provides instructions to make a new protein called Elevidys microdystrophin. Now you know the basics on how Elevidys gene therapy is designed to work. For more information about Elevidys, please speak to your doctor and explore Elevidys.com. Stay tuned for important safety information.
Important safety information. What is Elevidys? Elevidys is a prescription gene therapy used to treat ambulatory individuals at least 4 years old with Duchenne muscular dystrophy, DMD, who have a confirmed mutation in the DMD gene. Elevidys is approved under accelerated approval for non-ambulatory patients at least 4 years old with DMD who have a confirmed mutation in the DMD gene. Accelerated approval allows for drugs to be approved based on a marker that is considered reasonably likely to predict a clinical benefit. Elevidys treatment increased the marker Elevidys microdystrophin in skeletal muscle. Verification of a clinical benefit may be needed for Elevidys to continue to be approved for non-ambulatory patients with DMD. Who should not receive Elevidys? Individuals with certain types of mutations. Any deletion in exon 8 and/or exon 9 in the DMD gene should not receive Elevidys. What is the most important information to know about Elevidys? Infusion-related reactions, including hypersensitivity and serious allergic reactions, anaphylaxis, have occurred during and after Elevidys infusion. Symptoms may include fast heart rate, fast breathing, swollen lips, shortness of breath, nostrils widening, hives, red and blotchy skin, itchy or inflamed lips, rash, vomiting, nausea, chills, and fever. Your doctor will monitor you during and at least 3 hours after Elevidys infusion. If an infusion-related reaction occurs, your doctor may slow or stop the Elevidys infusion and provide additional medical treatment as needed. Contact a healthcare provider immediately if infusion-related symptoms occur. Elevidys can increase certain liver enzyme levels and cause acute serious liver injury. Patients will receive oral corticosteroid medication before and after infusion with Elevidys and will undergo weekly blood tests to monitor liver enzyme levels for 3 months after treatment. Contact a healthcare provider immediately if the patient's skin and/or whites of the eyes appear yellowish, or if the patient misses a dose of corticosteroid or vomits it up. Administration of Elevidys may be delayed in patients who have acute liver disease until the condition is resolved or under control. Patients with pre-existing liver impairment, chronic liver infection, or acute liver disease may be at higher risk of acute serious liver injury. Immune-mediated myositis, an immune response affecting muscles, was observed in patients with a deletion mutation in the DMD gene that is contraindicated. Patients with certain mutation deletions in exons 1 to 17 and/or exons 59 to 71 may be at risk for a severe immune-mediated myositis reaction. Caregivers should contact a healthcare provider immediately if the patient experiences any unexplained increased muscle pain, tenderness, or weakness, including difficulty swallowing, breathing, or speaking, as these may be symptoms of myositis. Myocarditis, inflammation of the heart, has been observed within days following Elevidys infusion. The patient's doctor will conduct weekly blood tests for the first month after treatment to evaluate troponin I, a cardiac protein that can detect damage to muscle cells in the heart. Caregivers should contact a healthcare provider immediately if the patient begins to experience chest pain and/or shortness of breath. More frequent monitoring may be required if the patient has cardiac symptoms. Patients need to have blood tests to ensure that they do not have antibodies that may prevent them from being able to receive Elevidys, as introducing the gene therapy could increase the risk of a severe allergic reaction or prevent desired therapeutic levels. Treatment with Elevidys is not recommended for patients who have high antibodies to the vector, the part of gene therapy used to deliver Elevidys. Due to the need to follow a corticosteroid regimen, an infection such as cold, flu, gastroenteritis, stomach flu, otitis media, ear infection, bronchiolitis, respiratory infection, etc., before or after Elevidys infusion could lead to more serious complications. Caregivers should contact a healthcare provider immediately if they see any symptoms suggestive of infection, such as coughing, wheezing, sneezing, runny nose, sore throat, or fever. Are there any considerations for vaccination schedules and Elevidys? Patient vaccinations should be up to date with current immunization guidelines. Vaccinations should be received at least 4 weeks prior to starting the corticosteroid regimen that is required before receiving Elevidys. Are there any precautions that need to be considered when handling a patient's bodily waste? Vector shedding of Elevidys occurs primarily through body waste. Patients and caregivers should use proper hand hygiene, such as hand washing, when coming into direct contact with patient body waste. Place potentially contaminated materials that may have the patient's bodily fluids, waste, in a sealable bag and dispose into regular trash. Precautions should be followed for 1 month after Elevidys infusion. What are the possible or likely side effects of Elevidys? The most common side effects that occurred in patients treated with Elevidys were vomiting, nausea, liver injury, fever, and decreased platelet counts. The safety information provided here is not comprehensive. Talk to the patient's doctor about any side effects that bother the patient or that don't go away. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also report side effects to Sarepta Therapeutics at 1-888-SAREPTA, 1-888-727-3782. Please see full prescribing information at elevidys.com.